Well, let's understand what the WHO is saying. I'm being joined now by Dr. Femi Akodu. He joins us via telephone here in Lagos. Dr. Akodu, thank you so much for joining us on The World Today.
Thank you for having me as one of your guests.
Now, we've not recorded any cases of Ebola in Nigeria, but should we really be concerned?
Yes, we should really be concerned.
Why would that be? Because we haven't had any cases. I know there was a scare at some time, but then the government ruled that out, saying that it was probably cholera or something else. But, I mean, it's one case has been recorded in Ghana already, and we know how porous our borders are. So how easily could Ebola be transmitted? Or how easily can it go through our borders here into Nigeria?
Well, if we look at, see from this perspective, the means through which the infection can be transmitted, there is what they call a primary exposure, in which is from animal to human. Or when someone travels to an area that is endemic for Ebola. So, for example, now people have been migrating from Nigeria either for business to Ghana or any Liberia or Sierra Leone. Because you won't say because there is Ebola that they shouldn't go there. If they went there and they have contact with an infected patient there and they came, then they become a suspect for the transmission. Then again, if you look at the animal that is also responsible, there is no barrier that limits the spread of the movement of the animal from one country to another country. So, which is a reason to let us know that we too are not 100% insured from the condition. So, we should also be on the red alert that.
Dr. Akodu, the WHO says that the figures are rising. Why do you think that is, especially in Guinea-Bissau? Well, in Guinea, it's quite understandable because the virus has been linked to fruit-eating bats. But
yes,
why are the figures also increasing in Sierra Leone and in Liberia?
Well, don't forget that they are all close-door neighbors. And as I have said, diseases don't respect geographical boundaries. So, if there's it's like what there's an article that says they're making noise behind your house and you care as if, you are not concerned. You wouldn't know what they are carrying, whether they might even drop it in your own location. So, Sierra Leone, Liberia, Guinea, all of them are more or less close door neighbors to one another geographically. And as I said, the disease doesn't know geographical boundaries. So the simple thing to do is that you are doing now, creating awareness for people to know that, there is an outbreak somewhere. So that if by way or by chance you find yourself in that area, you will be able to carry out certain preventive measures, such as the avoidance of eating or touching all this bushmeat. As you know that we like bushmeat in this part of the world, in West Africa. And food that you are talking about is one of the popular bushmeat that people eat.
Dr. Akodu, thank you so much for sharing your thoughts with us on the Ebola virus. We do hope that the African health ministers who are at that summit in Accra, Ghana, will come out with successful discussions. Dr. Femi Akodu is a medical practitioner.